So good afternoon, everyone. This afternoon's forum is titled Deliberate Indifference, Pandemic, Public Health, and At-Risk Populations. My name is Peter Goslin. I'm one of the three co-chairs of the Green Party of Connecticut. For folks who may not be familiar with the Green Party, we're an independent organization dedicated to people first and planet first solutions and committed to the four pillars of the international green movement, which are grassroots democracy, social justice, nonviolence, and ecological wisdom. On March 12, 2020, 2 years ago yesterday, Governor Lamont issued Executive Order 7, which was the first to address the impact of COVID-19 in Connecticut. And that order began with a list of whereases, as most executive orders do, including a stated recognition that the risk of severe illness and death from COVID-19 appears to be higher for individuals who are 60 years of age or older and for those who have chronic health conditions. And there is an increased risk of rapid spread of COVID-19 among persons who are living in congregate settings. In spite of the identification of some of the most profoundly at-risk communities in that initial order, Executive Order 7 contained no public health measures directed at them, with the sole exception of a restriction on visitors to nursing homes. We're now 2 years from that first executive order, and I think we have to admit that in Connecticut, not a single major reform of healthcare or of public health policy has taken place that is primarily addressed to those people who are most at risk of infectious disease. And really, we've gone backwards, so much so that it has become common to say that people who are still coping with the real risk of COVID-19 are merely, quote, living in fear, or else it should be ignored while the rest of us, quote, get back to normal. It didn't have to be this way, and that's why we chose the title Deliberate Indifference for today's forum, and it's certainly not too late to make changes. Contrary to the endless noise that's generated by the corporate-owned media, disability rights activist Mia Mingus points out that really none of us are independent, that when it comes to matters of public health in particular, we are all interdependent, and that if we make the change that is needed to protect the most vulnerable members of our community, the result is we create the safest conditions for everyone in the community. This afternoon, we're joined by three powerful women activists, Kathy Flaherty, Alex Marie, and Alicia Hernandez. We're going to start out by giving each of them the floor to share their thoughts and insights. Then they will have an opportunity to interact and discuss with each other. And lastly, we'll try to get in some time for Q&A. As the program progresses, if you have a question you'd like to pose to one of the speakers, please write it into the chat box, and I will be reading questions to our guests at the end of the program. So without further ado, our first speaker is Kathy Flaherty. Kathy is the Executive Director of Connecticut Legal Rights Project, Inc., www.clrp.org, an agency that provides legal services to low-income individuals with mental health conditions on matters related to their treatment, recovery, and civil rights. Kathy combines her personal experience as a psychiatric and long COVID survivor and her legal background to speak to issues affecting people with disabilities. Kathy lives in her hometown of Newington, Connecticut with her husband, Jim Valentino. And Kathy is on Twitter as @ConConnection. That's at CONN, CONNECTION, @ConConnection. Kathy has written op-eds on a variety of topics, including politics, law, mental health, adoptee rights, and soccer. Kathy, turning it over to you.
Thank you so much, Peter, and thank you to the Green Party of Connecticut for the opportunity to speak with all of you today. March 12th, 2020 also represented the day I woke up with a fever. Thought I would be better in 2 weeks because that's what we were told, and I really haven't gotten better since. So that was the start of my journey with COVID. I will tell you that basically from Twitter and a lot of the people who I was following at the time and still am, who are very high risk, who were talking about things really back in January and early February and really paying attention to things early. Because we at Connecticut Legal Rights Project represent people who are currently residing at state-operated inpatient psychiatric facilities, one of the stories the early stories that was really concerning to me was something that came out the last day of February, where it noted that either 7 or 8 people had died at an inpatient psychiatric hospital in South Korea. And I think that's when we knew that we would really have to be paying attention to this virus. We would have to think about the way we did our work, because we used to regularly go on the inpatient units. And we were very concerned about the health and safety of our clients, with good reason. For people who don't remember, there were 5 people at DEMA's facilities who lost their lives in those first months of the epidemic. And a lot of people got sick, but 5 people who were transferred to the local general hospital later died there. And so one of the things that we were most thankful for later, and I think it sort of speaks to even when we were learning more, who were we prioritizing in the state's response, and were they making sure that people had access to the tools that they needed to protect themselves? You know, a later wave swept through the units at Connecticut Valley Hospital, and on one of the units that was for geriatric patients, everybody in the unit got sick. I think the one good thing was that they had been vaccinated, so there weren't any deaths in those later waves. I just want to talk a little bit, because I know we have 2 other awesome speakers, but the sort of thing that we saw in terms of, I had forgotten the original declaration noted the high risk for people in congregate settings, and noted that people with health conditions were at higher risk. But at almost every point during the state's pandemic response, we have had to remind people in power that people with disabilities exist. Obviously people who are disabled and are also Black or brown or poor, low income, all those things. It's multiple marginalizations, but just in general, reminding people that not everybody has a car. So all those mass testing sites, the mass vaccination sites that were drive-through, great if you have a car. Not everybody has access to the internet. So everything that required you to sign up online wasn't available equally to people. When they even recently, when they started doing the pickups for the the test kits and the masks, first come, first served, drive up. It's like, that doesn't work for a lot of our folks. And the fact that we had to keep reminding people all the way through, Peter may remember, Connecticut Legal Rights Project actually brought a lawsuit against the state of Connecticut for their COVID response in the DEMA's facilities that ultimately was settled, because over the passage of time, we ended up withdrawing it, because at that point in January of 2021, people were getting access to the vaccines. But at the beginning, our clients were calling us saying, we can't get masks. The staff isn't wearing their masks properly. They didn't have access to PPE because I think people forgot about inpatient psychiatric facilities. I think people forgot about people with disabilities who are living in the community. They eventually came around. But if you think about the fact that that very first order said, these are the people at higher risk, why was there not more effort to incorporate those folks in the response? I think the other thing that was eternally frustrating was that in the reopening plan, the recommendation for people who were younger and high risk, even at the phase 3 of reopening, was to stay safe by staying at home, which meant that there were people who were prepared to leave us behind. And I think at this point, we're seeing exactly that, that rush to return to a normal that wasn't working for so many of us. And removing mask mandates when there are a lot of people who are high risk who have to go do things too, have to go to school, have to go to work, can't get accommodations. have to go to government buildings. And yet the steps that keep the most at risk people safe are steps that keep everybody safe. And the moving of the goalpost, the fact that, in one afternoon, despite nothing had changed except the way we measure things, Connecticut went from high risk to low risk in one afternoon when nothing had really changed. So it will be, I think there are a lot of us who are just waiting and seeing. We want this pandemic to end more than anybody. But I think we're just worried that, especially with the new metrics being the way they are, by the time hospital systems get impacted and numbers show up and they're like, oh, we have to do something, that it will be far too late, and people will needlessly die who didn't have to. I think the last thing I'd want to say is that, the only outcomes of COVID aren't mild asymptomatic cases or death. There is a huge gray in between of a lot of people who, even though they had mild cases, because I was one of them, have not been able to get through this without lasting symptoms. Life for me is a little bit more back to normal than it was, just in terms of being able to return to work full time and return to some of the activities that I used to do. But it's just not the same. And it probably never will be. And we're still dealing with all the medical complications of, what everybody told me back in March of 2020, that I would see everybody in 2 weeks because it was just like a cold or a flu. And I don't blame anybody for saying that, because I think that's what a lot of people thought. But know that there are a lot of us out here with those lingering long haul symptoms, and it's not all in our head, as I know probably everybody here knows, but that's something that you still hear a lot of, that's very frustrating to all of us. But anybody who lived with a chronic illness before COVID knows that that was unfortunately something that was already there. And I think, unfortunately, while COVID exposed and exacerbated a lot of those problems, we haven't seen the substantive changes in policy that we really needed to see. And I look forward to the rest of the discussion and seeing what ideas people have come up with for what they think we need to do. So thanks again.
Thank you, Kathy. And we're really interested to have you interacting with our other two speakers to see what comes from that, because I think that's going to be very interesting for all of us. Our second speaker is Alex Marie. She's a local disability activist with a focus on chronic illness. She has lived with a rare immunodeficiency for 10 years and is an advocate for increased awareness and medical accessibility for people with chronic complex illnesses. I will say this, that Alex is the person I learned the most from during the pandemic in just about every respect. Somebody who I have a great appreciation of. And I really appreciate it, especially that she's here today to join us and and contribute to this discussion. Alex, up to you now.
Well, hi, thank you. I finally made it here. Thank you for the wonderful intro, Peter. And again, thank you for bringing us all together here today, because, the past 2 years have really been difficult. And it's been very difficult, especially in the chronic illness, or as we call ourselves, the Spoonie community. It's been very difficult to try to get our messaging out. It was difficult prior to the pandemic, and I thought that perhaps with the pandemic's unfortunate occurrence, there would be a greater awareness that was opening up to the realities that chronically ill people with complex illnesses face daily. But it seems like there hasn't been room for that discussion yet. I'd like to just say hello to the other panelists. I'm sorry, I just came in the tail end, Kathy and Alicia. But just to a little bit of a background about myself and so the things that I personally have noticed that were striking to me as a disabled woman in the pandemic. I would break them into really three discrete categories, which would be the medical system, the sort of financial overarching, like how get the trains in running on time, sort of infrastructure that just everybody lives with, and then also the government from any federal, state, and local responses to how to handle just the pandemic response and the needs of high risk and vulnerable populations. So I'm looking forward to being able to discuss that with everybody. And it should be a good time.
Our third speaker is Alicia Hernandez. She is an activist and founder of the New Britain Racial Justice Coalition. The NBRJC was formed to empower people in the New Britain area to challenge racism through political education, coalition building, electoral engagement, policy advocacy, mutual aid, and direct action. And we're very pleased to have Alicia participating in the discussion with us today. Alicia, it's open. The mic is open for you.
So I don't know how much, I missed how much you said about the work that we do in the coalition, but I can give a quick synopsis to understand the perspective that I'm coming from. So New Britain Racial Justice Coalition has a program called Alternatives to Incarceration. It's a program that we push to try to encourage policymakers to look beyond incarceration and policing to deal with social issues. One of the things we do with that program is we work with currently incarcerated writers and we help them publish topical issues about what's going on in Connecticut prisons. So I wanted to start, it might turn off my camera when I read it, but I wanted to start by reading something that's coming directly from one of our incarcerated members, because throughout the pandemic, we've continued to receive concerns about the health and safety of inmates, especially inmates who have disabilities. So I'm going to share that now. My name is Terrell, and I came into prison to finish my violation of probation of 4.5 years. When I was commencing my sentence 5 months in, I was confronted with COVID-19 and its deadly repercussions. The prison was supposed to ensure drastic measures were taken to minimize the prison population so that social distancing within the prison could be achieved to prevent the curtail of an excessive exposure to the virus. It does not compel the government's interest to have me incarcerated among inmates or staff who have contagious diseases. Vaccinated people can still spread COVID-19, and clear deliberate indifference is imposed on inmates who cannot social distance, as I am currently sleeping on top of an inmate. That is not 6 feet social distance. So I wanted to start by sharing that because I think it's important that we always center the people who are most impacted by things in our discussions about them. And we've been getting these types of letters from all of the prisons across the state, from the women's correctional facility. We've gotten complaints about this. And I think what people need to understand is the health system in Connecticut prisons is already horrible. I think they contract out to UConn Health. It's already bad pre-pandemic. So you can only imagine how the pandemic made that even worse. Most people are not getting the support that they need for their disabilities. So the first thing that folks have been noticing is a lot of correctional officer insubordination. So correctional officers are among the lowest vaccinated among all state employees, which puts folks at particular risk in the prison system. So it wasn't just vaccines, though. There was issues with COs wearing masks. I remember when I went to go visit my cousin, I would repeatedly see COs in there without masks. But if you took off your mask, you would get your visit ended and you'd get reprimanded. So the mask situation even became a complicated power dynamic. I think the other issue is just generally lack of adequate PPE for folks in prisons was a huge issue. A lot of people mentioned, again, the social distancing. So for those who are in dorm settings, which is a lot of level 3 prisons, social distance in a small, tiny cube. And so this was another issue. And even when they did detect people with COVID-19, the quarantine procedures were insane. So, for example, my cousin had a situation where they wanted to reintegrate a quarantine dorm into the rest of the dorm without ensuring that they all tested negative for COVID. And it got to a point where the inmates in that dorm told the COs, no, they can't come in here. They cannot come in here because you're putting all of us at risk. They ended up taking the prisoners back, testing them all, and it turns out, I believe 2 or 3 of them had COVID, tested positive for COVID, and they were getting ready to mix those in with the rest of the population. So you could see the general mismanagement of this, and that coupled with the fact that a lot of the workers that are in there, the health workers, are completely overworked. There were situations where they had nurses working 24-hour shifts with all of these inmates. So it truly has been a disaster and continues to be a disaster. And I think the other piece of this is the mental health piece of this, which often gets overlooked, but shouldn't, especially because a vast majority of people who are incarcerated are already suffering from mental health conditions. The mental health conditions, I mean, the access to services alone have been an issue. I had a woman write to me from Burke Correctional Facility, and she was like, a lot of these young girls are having a hard time, especially when they have to quarantine, especially when the jail locks down and they can't contact their family members. And they are literally asking for mental health support and being refused it. And the only way you can really get that support is saying that you're suicidal, essentially. So that is a huge problem because with these quarantines, with these prison lockdowns, people are becoming increasingly isolated. I remember there was a huge period of time where I couldn't go visit my cousin. I think they canceled virtual visits at one point. Like, they really restricted their already restricted contact to the outside world and to loved ones. And that has taken a significant toll on mental health. Everybody who's talked to me, who's currently incarcerated, who has been incarcerated during the pandemic, has continued to bring up this issue of mental health as something that needs to be looked at, that is not being sufficiently looked at. And I think in the same vein, in the beginning of the pandemic, one of the things they were doing, because they quarantining facilitating people at Northern. So for those who aren't aware of Northern Correctional Facility, it used to be the state's only supermax prison, which was eventually closed down after activists protested against the inhumane treatment of folks there. And they started using that for quarantining. Now, that's a problem because any person who's incarcerated in the CT system knows about Northern, and that's not a place you want to be, even if it's just for health purposes. So a lot of people were not reporting symptoms because they didn't want to get sent to Northern and essentially be placed in solitary confinement. So I think these are kind of the main issues that I've been hearing from our New Britain Racial Justice Coalition members who are currently incarcerated or who have been recently released. It's just exposing further the failures of the health system there. And it's unfortunate because the people who are being impacted the most are the people who have disabilities, who can't get the PPE they need, who social distance, who are not being granted compassionate release. That it's horrible. And there was a man, actually a friend of one of our members, who passed away from New Britain. He was there for a 6-month sentence. And these are turning into death sentences for a lot of people, especially people with disabilities and older folks, when they shouldn't be, and nobody's looking an eye. It's extremely disturbing. It's that we continue to put people in for all of these low-level offenses, most people who aren't even a danger to society. So it's still concerning. And I think the last thing that I want to say is that for people who are incarcerated, the pandemic is not over. I think for a lot of us, a lot of things are getting back to normal for certain demographics here in the outside. But on the inside, one of my friends just called me and he got COVID because of their congregate living quarters, coupled with the fact that the staff there are largely unvaccinated. They're still at severe risk and they're still experiencing it. So keeping that in mind as well. Thank you.
Thanks, Alicia. And I just wanted to mention, Alicia missed her train earlier today, and the reason that she is en route from one place to another is because she agreed to join us under, let's say, somewhat adverse circumstances, and we very much appreciate that. I also just want to go, because this was really, I think, my error, and I just want to go back to Alex for just a minute, because I know you came in after the beginning. Kathy and Alicia both sort of like laid out whatever they had to say. You gave a little introduction, and I'm concerned that you had more that you wanted to say, and I didn't give you a chance to say it.
Oh, see, I wasn't, see, unfortunately, I came in a few moments late, so I wasn't sure if we were jumping right into the discussion or introducing ourselves, like generally first, and then laying out maybe more of a detailed, experiential, and analytical perspective of like what we've been experiencing and what we've noticed, because like Alicia just did like an amazing job of like even explaining everything that like I read online about the prison system and the issues that were facing everyone in there. And it's terrible because when she said, you know, they're still locked in, a vulnerable population still locked in. And the risk that's happening right now is that people, like general society thinks whether they're correct or not, it's time to move forward. But you're leaving these other populations behind, and like people who are incarcerated, but also people who are in situations similar to myself with almost still in a lockdown state, like from the beginning. And in the UK, they call people who have to stay in like very critical lockdown shielders, and we don't even have a term for it here in you know, in the US, which will tell you something about how closely we examine it. So if I use the term shielder going forward, I'm talking about like the very high risk medical groups of people who have basically had to remove themselves from most aspects of society for 2 years. And there's a heavy overlap with the same kinds of issues that are happening, not just from societal neglect, but also practical issues. I approach it more from the medical system, because if you've been chronically ill and in a broken medical system for a long time, you knew it was already broken prior to the pandemic, and the pandemic just sort of exposed the cracks in the glass when light shone through. And so it affected everyone, even healthy individuals, but the most vulnerable people who required a delicate balancing act between doctors, access to services, the bottom just collapsed out for us. And so a couple things that I personally would like to address are, you know, some challenges that people who are shielding have faced, and other people with varying degrees of chronic illness have faced that maybe have not been heard specifically by others who were able to go out and there's been, and these are all issues that also need to be addressed, and both on a local level and in an activism level, reaching out towards both local activism and the government on multiple levels. But from a medical perspective, you have, you know, doctors who unfortunately were overwhelmed, disappeared, and they were only seeing triage patients. And when you're disabled and when you're chronically ill, just because a pandemic happens, it doesn't mean that your additional things stopped happening. So there wasn't a system in place to address what's going to happen now beyond the triage point. So people who need appointments are denied access in the hospital. Two of my friends were in what would otherwise be considered critical, but not COVID critical situations, and they were turned away from the hospitals because there were no beds, because of the beds all being filled by unfortunately unvaccinated individuals who needed to be hospitalized. And the people are afraid to call ambulances. People are afraid to have medical personnel come in the house, because there was no overarching agreed upon regulation that trickled down from federal to state to local about agreement on masking, vaccination, access to access to, new life-saving treatments like monoclonal antibodies or monoclonal vaccinations. And unfortunately, there's a financial element in it too, because disabled people already face many financial hurdles, because part of being disabled is basically treading water a little bit on the poverty line through design of the system. And so services that we relied on, such as like SNAP, if you need food assistance, all of a sudden you can't use that for Instacart, DoorDash, any hot meal services. If you can't go to the grocery store, how are you going to get food? You have to rely on other people to bring things to you. The stimulus that came to all of us was appreciated, but certainly not enough for anyone. And if you were unable to work, or you were between jobs when the pandemic happened, which is what happened to me, I was between jobs, I didn't qualify for any kind of unemployment assistance because I didn't have to leave a position because of the danger to my health. So I've in essence been out of work for 2 years, and you're trying to make the money last. And I've even spoken to people on 211 asking, like, well, for people like me who have to just continue to wait it out, what are our options? And they don't have any options. And facilities also, it all comes back to a lack of awareness and also a lack of unification in metrics and how we're going to approach everything to include everyone. You can't just say, oh, the healthy people or the people who were infected, the people who are vaccinated, who have the most protection, they can go out. What happens to the percentage of the population where the vaccines don't work, where they require extra protection? There's nothing in place. There's no dialogue. There's no discourse even now as everyone's opening up about what's going to happen to us. And the resources are not available, and access to like medical professionals are not available. Access to financial and social resources aren't available. And unfortunately, I have had difficulty even bringing this subject up in local community, because I come from a very progressive political orientation, and in our communities, there was a silence around disability rights when the pandemic occurred. And I felt that this probably, it was unexpected, because I believe, disabled people are intersectionally oppressed and also are allied with many other marginalized groups. And there's just seemed to be an absence of any kind of coherent organizing, even on a local level, because we always talk about how, it has to start local, and it has to start with mutual aid. And we can't always rely on the federal government or the state government coming in to help us. And I think this is a prime example of how that has to happen. And it has to start from the state level, the local level, because even the state level, it didn't. And there were no coherent groups that seemed to come together to organize for that. But there were organizing attempts for other social justice activism points. And when this was pointed out, it was not met really with a coherent or particularly very receptive response. And I think that part of what we all have to do, is first and foremost, start local, come together and reach out and raise awareness with marginalized populations that are all affected, who are all locked in and in essence locked out of society, whether it be the prison population or the shielder populations and the vulnerable populations. And we can't also forget that there are a lot of children who can't receive the vaccine just due to Pfizer and Moderna, the trials not working out right. And there's a big, debate with the school systems about masking, remote learning. And again, the children still haven't really been protected. And to a greater degree, those children who live in multi-generational homes or who live with vulnerable parents, or if the children are vulnerable medically themselves, there doesn't seem to be an answer being provided for them either. And a lot of parents are really concerned about this right now. And so there are multiple groups that are seemingly being left behind, and we need to come up with some kind of strategies, even if we start small, even if we start local. And that's why I'm here, and that's why I'm interested to talk to everybody, because I have my ideas, and I'm sure everybody else has their ideas too, coming from different life experiences, different perspectives. So I'm really looking forward to that.
Thanks, Alex. So what I would like to do at this point is to really give the three of you an opportunity to engage however you like. I think that one of the things I've been hearing so far, and it's certainly been something I've been thinking about, is, okay, so what do we do with the reality of where we are today? It would certainly be it would be foolish of us to assume that the pandemic will be over tomorrow. That seems clear. And it also seems foolish to suppose that the conditions that existed even before the pandemic for disabled people and people with chronic illnesses and people in prison dealing with the health issues in prison, it would certainly be foolish to assume that what we had before was adequate. Question, therefore, is what sort of, among others, what sort of changes should we be looking towards in the future, and how do we begin that process? But I'm not going to limit you to that. I want the three of you to feel, anybody that wants to jump in, it's your show. Go ahead.
I can start.
Go
in
ahead.
terms of the things that I need to be changed, I know this is a grand vision, but we need to abolish the carceral system in this country. Plain and simple. It is literally being used in a way that is not beneficial to anyone. It doesn't help our communities. It doesn't help the people in there. And I think what the pandemic has shown is just how cruel the system is. So I feel that we need to move away from these types of kind of incarcerating, locking people up, and start to deal with the underlying conditions. Because what we often find is that the conditions that led to some of the antisocial behaviors that then led to incarceration often come down to healthcare and mental health care and things of that nature. So yeah, that's my thoughts.
This is Kathy. I'll co-sign what Alicia said with that. And I think we see that, even when we take an institutional approach to people with mental health conditions and we put people on these locked psychiatric units. A lot of people really don't think of psychiatry as a carceral system, but it really very much is. And I think there has to be some recognition of that. I was struck by what Alex said about not being an organized response from the disability perspective. And that shows me that we were good organizing within ourselves, within the people that we already knew and were already connected to us, but we didn't figure out effectively how to reach out to people who didn't already know about us. Like the Connecticut Cross Disability Lifespan Alliance did a lot of stuff. Keep the Promise Coalition was doing a lot of things. Disability Rights Connecticut and Connecticut Legal Rights Project were doing things legally, but we were probably only talking to our little circle of people. And I think if there's anything the last 2 years have shown us is that we need to figure out how to make those circles bigger and more inclusive, especially when people are not already linked to an organization. And that's just something I think I've found in Connecticut for a long time, is like, if you've got a connection, you're good. But if you don't have that connection, or you're trying to figure out how to make those, it's a challenge. So I really appreciated you just being so clear about that, Alex, because I think that gives us a lot to think about, how we can be more effective and inclusive in our advocacy. So thank you for saying that.
Oh, thank you, Kathy. You bring up a point actually that I was thinking of too, when you say everyone was sort of within their own circles, and like we all have our causes, you know, like we all are allies to each other, but we all have our causes, I find, you know, like the things that personally impact us. And in the disability community, I think part of it is also like a type of identity, like there is a lot of organizing in the queer community, and there's a lot of organizing for racial justice, and there's a lot of organizing, you know, anti-war movements. And what happens is disability tends to be something that is added on to another, like someone sees themselves primarily as fighting for queer rights, but they may be disabled. But the actual disability rights as a separate thing to be considered kind of sometimes is a little bit lost. And I think part of the reason it's lost is that there's a social stigma a little bit that people, I mean, everyone, their ableism permeates through society. You see when Alicia mentioned how people are treated in the prison system and how people even end up incarcerated. Part of it is like just ableist practices of not identifying mental health, or even like, I think there's a statistic about traumatic brain injury that has gone like undiagnosed, and the prison population, a lot of people have suffered traumatic brain injuries and it hasn't been treated or addressed correctly. And there's also ableism in not shying away from saying, well, I am disabled, I am ill, and that doesn't define exclusively who I am, but that defines the lifestyle that I have to live and the unique challenges I face. And so because there's a little bit of shying away from that, attaching oneself to that label, there's a little bit of an issue there. And I think also the people who are in the trenches doing the disability activism work, a lot of us found our way to it. Like it found us as opposed to us finding it, because a lot of us found our way by becoming ill, or by falling out of the system, or having a loved one who became ill, seeing the medical injustice that happened. And then we have no choice but to fight. But because a lot of us are also ill, finding allyship is incredibly important, because a lot of us want to do so much, but we are limited in the amount of spoons in the spoon community, the energy allotment that we have, and the physical, mental, emotional, neurodivergent health limitations that we may have. And so we may start something and have a setback medically, and then if we're the only ones running the ship, then we lose momentum. And so if we could figure out a way also to bring in allies, abled allies, diverse allies with different perspective, who will stand by us when we sometimes can't stand up ourselves, that is going to be so important going forward. Because I look for the mentors. Like, as also a member of the queer community, there is an absence of mentors, the elders in our community that were lost to the AIDS epidemic. And when you look in the disability community to the elders and to the mentors, you hardly find any, because they were lost to death. And a lot of it was preventable. So we have to build stronger networks going forward that way, not just scope. And there are a couple models that I have actually seen, if we have time to discuss them at some later point, that actually I found very effective locally, grassroots level, that were online, that helped during the pandemic. But I think you're absolutely right that we have to figure out a way to branch and network into the greater community through messaging as well as action, like even if it's small local action, to just make our presence aware. like make others aware of our presence.
And if I could just underscore, I think a really important point that Alex just made, the way that disability rights work is siloed. When we started organizing the Lives Matter movement in Connecticut, you know, a lot of the Black disabled community was like, you're doing marches that I can't physically do. And even, especially during the pandemic, they could not go to in-person events. And so even within racial justice organizing, there's this question of how are we being inclusive? Are we just siloing issues, or are we truly taking an intersectional approach?
This is Kathy. I think that's been a long time challenge of various movements. And the thing that's really challenging for me in terms of being somebody who identifies as disabled is making sure, you know, I just think of the experience I have along with a couple of friends who are lawyers with disabilities. If we're not in the room, disability does not get raised, which means it always counts on us being present. And I think the thing that's interesting and where I kind of go back and forth is people with disabilities are everywhere. We are part of every single community. It's like 1 in 4 of us, 1 in 5 of us, no matter, you know, and really it's the one protected class that is the only protected class you become part of, really, as opposed to being born into it. And some people with disabilities are born with them. And I think there's a very different experience between somebody who is born with a condition and then acquires a condition. I already was disabled before COVID, but my experience with what I've acquired over the last 2 years has been a profoundly different experience. But I think I'm glad Alex brought up the online, because I think the disability community online is fantastic, and frankly is probably what saved my sanity the last 2 years is knowing that there were other people out there who were being those Cassandras and like constantly warning of what bad thing could come next, wouldn't be listened to, and then yet another prediction would come true. And I think, you know, to Alex saying too about the spoons, we're just tired. And I think that's the hardest thing, is having to do this when it's so a part of your life, you don't really get to turn it off. You kind of need to for your own mental health and well-being. But that's something I know I struggle with, is being able to just turn it off at the end of the day.
Absolutely. Absolutely. You're absolutely right. I mean, we can't we live like we're not just choosing a cause that we feel passionate about and going into the space, and we're living it. Like I once had a doctor tell me, like, congratulations, this is your career now. This is your job now, being a professional patient. And like, we have to find ways. Like I hadn't even mentioned when I come into like my consideration of trying to find solutions, the mental health and the social health aspect of it are also crucial, because I just seem to take those for granted. Like, people should know that we're not doing so well right now. Like, check in on your disabled friends. We're not doing so well, because half the time we're worried so much about like, how am I going to get from point A to point B physically, that you don't even have the space for the mental renewal and the social renewal. And that's something in our activism movements across the board where we're fighting so hard all the time. And you did mention, like, Kathy, you've mentioned the virtual spaces, which have been great for us because, you know, for those of us who can't go and do things, we can continue to raise awareness. We can network with people. We can use social media to amplify our voices and come together. But I still feel like, having been in those spaces for now 6 or 7 years, and then through the pandemic, when those spaces actually opened up very briefly to the general public with lockdowns and everybody panicking, I still feel like those spaces once again closed. Like it was an opportunity to keep those spaces open, and people who didn't have to be in them migrated away from them after the initial COVID crisis of the trauma, in 2020 happening, finished. And I think what we really need to do is, from some practical standpoints, I come from a tech background, and we have to look at how social media in particular, if we want to use it as a platform, how the algorithm influences what is disseminated around. Because using the algorithm and using large numbers and crowd to increase reach doesn't, like in the disability community, we've stayed kind of sort of amongst ourselves, and the reach hasn't been amplified. And I wonder how much of that is built into the system of social media, that disability is considered a taboo subject. Like on Tumblr, disabled posts were taken down when Sesta Fosta happened because bodies were involved and things like that. So I have to wonder, like, what's going on there. And so I also am very interested in how do we use the virtual to then move, to keep the virtual hub, but then move the virtual to on the ground. And one place, if anyone hasn't checked it out yet, that I saw tremendous success in this happening with, was the Vaccine Angels Facebook group. And they were created at the beginning of the rollout of the vaccines to help people, everybody get access to vaccines, because it was kind of like the Wild West. It was just like, get on a computer, sign up when your age demographic opens up. And you have, first of all, you have barriers socioeconomically with the computer and access to the internet. You had barriers for people who are not digital natives and in vulnerable groups who might have been in like an over 65 demographic. You had like people in nursing homes who didn't know how to log onto the computers and book their vaccines. And then you had other immunocompromised people who couldn't travel, who couldn't get around, and disabled people who might have tech access barriers. And this group came together and was committed to finding everybody access to vaccination, and also promoting correct information and statistics drawn from countries all over the world and the CDC, and disseminating accurate information, talking to people who are vaccine hesitant, and informing everybody about, masking protocols, school protocols, keeping everybody abreast of the next variant and the surges and everything. And you saw people coming from all walks of life into and all stages of health into that space, and coming together to work together to get people vaccinated. And I think that that was a wonder. It still is in existence now, and that was a wonderful, successful model that worked to both online and translated out into real world results from an online platform. So I think going forward, if we could look into the strategies used there, I think that would be a good starting point.
I think one of the things that I've seen is that it's been a matter of us keeping ourselves safe, or us doing the helping of our community members. I think I mentioned before about, the vaccine clinics, not just that they were mass vaccination sites that were drive up, but, the form that the Department of Public Health had for people who were homebound, was impossible, literally impossible to use, even if you knew how to use a computer. It was just if you got tech, it was like a badly designed form. And then what they didn't seem to understand is that it wasn't only people who were physically homebound, but there was no recognition of people with mental health conditions like agoraphobia or, other extreme anxiety as being people who should have been eligible for to get the vaccine at home. But then you had the DD Council, the Developmental Disabilities Council, step up and then partner with the town of Vernon. And they really had these great accessible clinics where they designed them to deal with all the sensory issues that would come up for certain people, would make the appointments much longer, recognizing that they might have to, it wasn't just a matter of show up, roll up your sleeve, get the needle stuck in your arm, that there would have to be some more talking involved, keeping people physically safe involved. But that's what sometimes happens. And I just think back on that original vaccine rollout where you got the old folks done and then, whatever the next group. And all I remember, and this was especially so many friends who I was talking to online who I knew were from Connecticut. And we knew, like on that Monday, they were supposed to be announcing for the younger people who were high risk. And then the governor comes out with his announcement, we're doing a purely age-based rollout. Granted, administratively easier. You don't have to think about it. It's not hard. But it really, but for the fact the federal government so increased the amount of vaccines available, it really put high-risk folks at additional risk that wasn't necessary. And it was all because it was, and I'm not lying. I mean, this was his quote. He said it's too hard.
Yeah.
And I mean, that's why I came up originally with the line Connecticut Indifference for this, because when you see our whole hashtag Connecticut Difference and how awesome Connecticut's doing, and I'm not saying Connecticut's not doing great, but is it doing great for everybody?
Exactly.
Are we all coming back equally? And we're not. So that's where I'm at.
Yeah, the rollout was particularly problematic. I mean, like I was reading stories about, 20-year-olds who were waiting for transplants and teenagers and 30-somethings, they needed to go on chemo. They couldn't do it until they got vaccinated. They're waiting. And he's like, well, sorry, 3 months. I mean, I got my shot, and the way the timing turned out for me, I was so thrilled, and I walked out, and then 2 days later, they removed the mask mandates before the shot. By the time I got mine, but I qualified, they then started rolling back the mandates. And I think that was another big problem, that they rolled back the mandates before there was enough vaccination in the population to be considered like what they were originally calling herd immunity safe. I think that they rolled them back too soon, and then Delta came anyway, and there were all those issues too. And I mean, I had not even seen anything in the news about, we heard a lot about nursing homes, and we heard a lot about nursing homes, and it was suppressed. But then there's group homes too for people with disability, and a lot of that data was suppressed too. And then that goes along with the prison data that was also suppressed, even if they even kept any of it. I'm not even sure if they did. But we didn't hear, how did the rollout happen for those populations? Like Alicia was saying before, people were just there was almost like a punitive element that happened in the prison systems too. And there were people who couldn't post bail who were waiting, and they stayed through the whole pandemic waiting because they just couldn't post bail. I know people are in there for the wrong reasons, and people systemically, the system is failing a lot of people. People should not be incarcerated the way they are. People are not being served by being incarcerated. But also, when people are being incarcerated in our system, COVID-19 was not suddenly decided to be you didn't get a death sentence or a disability sentence for the crime you may have been convicted of committing or whatever. And now you're there, and like, I don't even know how vaccine access happens in the prison systems, or how it happened in homes that were not elderly based when the rollouts happened.
One of the things that you have talked about with respect to virtual communication and social media is that it, in some respects was a very effective way for people from the disabled community to get together and communicate with each other. And it opened up a little bit because of the lockdown, and then it kind of closed down again. How does all this relate, do you think, or does it relate to the sort of that ongoing perspective that somehow the virtual media, which is the place that many disabled people are limited to in many respects, somehow isn't real, that it's not as real, it's not as legit, it's not activism, it's something other than, or it's some sort of a substitute for, when in fact it was essential for so many people?
Honestly, I've encountered this a lot when I was on disability Twitter, where you would hear other activists from other groups saying, well, you're a keyboard warrior. You're a keyboard warrior. But the thing is, what they don't understand is, I think it comes from a place, unfortunately, of either willful or unintentional ignorance, that disabled people have very little, like we couldn't go to the Black Lives Matter rallies that happened in 2020 if we were immunocompromised, because we couldn't go to large crowds, like we have skills that we can bring, we have talents that we can bring, we have information, but we can't necessarily bring our body to every single demonstration, to every single and that's an accessibility issue. And ultimately, any activist who wants to criticize people who are disabled for using a method that's virtual, which allows greater accessibility to people who would never have a voice at the table if they had to bring their body in person to do it, has to re-examine their own kind of praxis a bit. But I think that amongst the disability community, it's seen as a vibrant space. Among other activism spaces, I think the disabled message is held back because there aren't physical presences as often. I think Kathy mentioned it, like, if I'm not present, or like she said, her other friends who were lawyers, if they weren't present in the room to bring up disability didn't get brought up. And the challenge is that you don't have to be physically present to be doing meaningful activism. Like I just mentioned with the vaccine angels, none of us really met in person, but that kind of activism that was virtual got so many people vaccinated and convinced vaccine hesitant people to actually go and get vaccinated too. And it was a virtual situation that had an impact outside of just the virtual space. I think what's happening is that amongst other activist groups, not the disability ones, but maybe other causes, there's a lot of ways of, everybody has an opinion, everybody picks fights with each other, everybody, debates and argues. And when in those spaces, if you remove the disability aspect, a lot of people feel like it's just back and forth debate, talking, spinning your wheels, not getting something done, or being a contrarian, or devil's advocate, or trying to dismantle something, and actually not going out and doing something. And that's been used as a criticism in those other spaces. And so it negatively impacts disabled spaces, because we're using the spaces that are accessible to us to create the change. But the prejudice on the outside is that the virtual doesn't have the same weight. And that actually does have to change, because everything is going virtual. Like, if you just look at other things going on in the world right now, things that are happening virtually.
Let me, so we have a few questions that people put into the chat. By no means is this a limitation on what any of you want to talk about or contribute, but let me just throw a few things out there. So the first question here from Mark, can you expand upon the idea of how invisible the disability community has become? And is it so more now than it was in the past, even before the pandemic? And why do you think this is? Why is the disability community so unseen?
Well, I'd like to try to answer that. And one is it's unseen because people choose not to pay attention to it, and people choose not to see it. I have a really hard time thinking of the disability community as unseen and invisible because I'm part of it. And I think part of I don't know what it's called, but there's something that, like, once you know something, it's really hard to imagine not knowing that thing, which means it sometimes is hard to communicate that thing to other people. But I just want to remind people that March 12th was also the anniversary of the Capitol crawl on the steps of the US Capitol, which helped get the Americans with Disabilities Act passed. Also remind you that people with disabilities were the people who saved Medicaid, because there were people who could afford to put their bodies on the line and arrested in protests in DC and in other places around the country. You know, there are activists in Connecticut who have sat in at the governor's office and gotten arrested there. But it shouldn't be, like to Alex's point earlier, it shouldn't be that you have to put your body on the line to be in a space. I think the ableism exists on both the right and the left. But I think the ableism on the right literally wants us to die. I think the ableism on the left is that people just aren't thinking about us. And so I think one of the suggestions that I really have is listen to disabled people and center disabled people in your activism, because it is likely that whatever conditions you work to create for them are actually things that will work for everybody. You know, when you think about accommodations, and I think I literally changed my email signature to a quote from Amani Barbarin, who said, "I hope you're at home enjoying the safety of the accommodations that disabled people have been fighting for years and have not been able to get." And the sad thing was, that's still my signature, but in the last 2 years, I think only 3 people have actually said something about it. And and which is what I expected. But you know, remote school, oh, that's too hard. We can't possibly do that. It's a fundamental alteration. It's an undue burden. But when we needed it for everybody, we could do it. Remote access for jobs, remote access for conferences. And that's a fight that I'm having now, because there are people who are really desperate to return to in-person conferences, and I get that. But if we're really going to be accessible and inclusive to everybody, we have to figure out a way to make that remote access possible. Because I think Alex mentioned real early on, the world opened up a little bit for some people who have to stay home for their own safety. And seeing it close again, when we had that bright shining moment of things being the possibility existing for a better world, is super frustrating.
I think some of this may be a little bit controversial, and excuse me for it, but I think there's a deeply rooted human element that, like, I know, like Kathy, like you just said, the right they want us dead. So like their ableism is like, we'll go die. And the left, I think a lot of times we sometimes lose sight of the forest for the trees a little bit, in terms of we see everything as societal constructs, and we lose sight of some of the biological elements and things that, like, the human impulses that we're always trying to better ourselves as people. We're always trying to, learn and inquire and integrate new ways of thinking. But I think that there are also some very fundamental biological impulses that we have to acknowledge, that, like, whether it came down culturally or it comes from something deep, like in our lizard brains, like when people are confronted with disability, just human psychology, I think it's something, there's also that very basic need of, like, I don't want to confront this. I don't want to deal with this. I want to remain ignorant to it because it scares me. It could happen to me. I don't want to face the fact that this could literally happen to me at any point in time. You could be walking home and that was your last day that you walked home before you became disabled. And by not acknowledging, like, it's not to shame anybody, and it's not to tell people they're wrong, they're right. It's just to make people aware that, like, this is a bias that could also be influencing you. I was somebody personally who became disabled at 28 years old with multiple post-viral syndromes that resulted from an immunodeficiency. And I'll tell you honestly, I didn't think about it at all the first 28 years of my life. And I had friends who went through disabled challenges, and I was supportive of them, but I had no way to understand, no way, until it happened to me. And then it's like seeing the world through a whole different set of eyes. And I never had the impulse to run away from it, but there's almost a cognitive dissonance, like the mind doesn't allow itself to imagine what could happen. And you have to proactively, if you are an abled person, you have to proactively choose to step into that space and understand that you may not, when we say empathy, sympathy, we may not be able to get empathy and sympathy to some degree, because if a person cannot conceive it in their minds to some degree, they might not be able to sympathize or empathize. What we do need is compassion, and we do need is understanding. And those are things that can be learned and taught and promoted. And so you might not understand my disability or why it's happening, but you can have compassion for the struggling of another human being. You can have the curiosity to understand why something is happening to someone else, why someone is living a different way. And Kathy, again, you're right that, like, I've learned too, if we cater certain structures in society to be disability accessible, it actually opens accessibility even more to abled people, because abled people may have struggled with the things too, but they could just get by, and they took it for granted with the ease of which they could overcome it. And then suddenly that barrier is removed because it allows disabled people in, and even abled people come in and they say, wow, this feels different. This feels easier. So I think to summarize, like, it's not in our activism circles too, it's not seen as one of the sexier causes out there, sadly, like putting your body on the line, fighting against war, fighting against injustice, getting arrested, civil disobedience. We can't do a lot of that, but our struggles are just as valid, and the strategies we use are just as calculating and strategic with the means that we have. So I think that's a lot of the reason we remain invisible. Like, it's a human nature thing for people who haven't experienced it secondhand or firsthand, but it's also a societal messaging thing. Like, ableism is so stitched into the fabric of our culture, like just with the whole idea of, like, the just world fallacy. Only bad things happen to bad people. Only if you were virtuous, you could overcome it. The bootstrapping, it's so stitched in there that we have to keep challenging those narratives. And I think the only way we do it is by continuing to be, like, unfortunately, even if we want to rest, continue to be loud and continuing to be present and pushing into the spaces, even if we're getting pushed out of them at the same time.
There was a comment in chat about the credibility of some of the data that was released about COVID in the prison system. And I'm just wondering if you are able if you want to comment on that at all.
I think what I can say is, like, they're notorious for poor data collection, and I think this pandemic is no.
I think we have some other freezing going on.
Yes.
The questions and pick one out. How, as collectivists aren't part of this disability community, how can we help?
I think some is thinking about us, invite to connect, and seeing those abilities as a necessary community that needs to be included in whatever your advocacy is, and really asking. It's really clear the disability community is not a monolith. So looking at just one of us, you see if just one, and even one of us within one of the multitude, because I work in health, one person with a diagnosis of bipolar disorder, you've met one person with bipolar disorder, and none of us should be, because none of us should ever be put in this position anyway, being like the representative of all people with disabilities, because it's impossible.
Yeah, I agree with what Kathy was saying about like asking, like inviting us into the space and inviting perspective and having our input, like you also come to the table, like perhaps consulting disabled people. And again, we're not all a monolith, so something may affect one group more strongly than another, like to use the example of like the VAMS system, that for signing up for the vaccines, anybody who had any disability that kind of had a barrier to accessing the technology, visual disabilities come to mind immediately. In particular, like people might have done better to have consulted someone like people in that space to better streamline the website and make it so that everybody could navigate it easier or have an alternative if you have a vision impairment. But I think also, in addition to just hearing our voices, I don't see a lot of legislation that happens specifically impacting disabled people. I know there are a couple bills going to the House and Senate on the federal level about SSI, changing SSI requirements and penalties that people on SSI have, and like income caps. But that's the first time that that's gone in, I think, 30 years. And I think that sometimes we're forgotten when legislation happens, because it's meant to apply to the most amount of people, but not necessarily to be the most inclusive. And so then something happens and there's a loophole that leaves us out, or we're forgotten, or there isn't legislation. I see very little legislation that's aimed to protect us specifically. Like the ADA even happened like over 30 years ago, and I haven't seen much since. Whether there have been things proposed or not. The only thing I've seen is like, are we going to repeal the ACA? Yes or no? And then what ends up, and that little debacle that happened a couple of years, all of us were worried if we were going to die every 4 months or not, because it was going to get repealed. And so, and in advocacy spaces, I was there also in advocacy spaces in person at that time, and there was very little being done, even back then before the pandemic. So I think bringing those matters up more frequently in a legislative context would also be helpful. And maybe Kathy being involved in legal aid and such would have more insight on that than I would. But I just feel like there hasn't been a lot of progress for about 30 years in terms of updating things specifically having to do with us, to protect our rights at work, to protect our income rights, to protect our bodily rights. Like, because I don't want to go outside and have somebody confront me and over wearing a mask because they don't think we should wear masks anymore, things like that.
And I think what I would say in terms of activists and politicians supporting folks with disabilities, from my end, really understanding the way that a lot of disabilities are criminalized, and in particular, mental disabilities. Even if you look at the data, Black folks with mental health issues are more likely to be killed by police officers, and things like that have happened here in the state. Most of the people who are in prison have suffered from some kind of disability. And what we see a lot of times is we see the over policing of folks instead of getting them the help they need. So recognizing that, I think, is super important, because when you look at mainstream media right now, they give this very one-sided narrative of crime and punishment, and these are good people and these are bad people, but they never really go into the depths of the issues that are causing these incidences. And so it's really easy to believe that somebody is a criminal or they're bad, when in reality, they actually need a significant amount of help that has been continuously denied to them in this society. So especially now when we're seeing all of these crime bills popping up, really keeping that in the back of your mind. Because I know right here in New Britain, people with mental health issues in particular are continuously policed but rarely offered services. So recognizing that that's a need, and recognizing that as activists, it's extremely important to advocate for filling that need.
I'm going to pose one more question for folks, and then give each of you an opportunity, take as much time as you like, to sort of give us some final remarks and final insights. So the last question that I have here, because there's such a range of disabilities which require different kinds of accommodations, do you find it challenging to build solidarity within the disability rights community?
I think that's a great question. And what I would challenge is, and this is something you've seen, is it's the difference between disability rights and disability justice. When you focus on rights, you're kind of doing the bare minimum that each person needs, as opposed to disability justice, which really is focusing on everything that people might need to be able to participate in a space, whether it's school, whether it's employment, whether it's activism. And I know when I've seen that done right, it's the places that say, turn your camera on, turn your camera off. If you need to move around during the space, that's okay. If you need to sit in one space, that's fine. If you need to lay in bed, that's fine. I don't see that. I see other places trying to import that model, but it's really, when it's done right, it's just so remarkably inclusive. And it's almost a point where you wonder, why haven't we ever been like that? Because I know for me, most of the time, I hate having my camera on. And most meetings I'm at, it's just a meeting, especially that I'm not a presenter on, but my camera will be off. And I've had people say, well, if you have a camera, you should have it on. And I'm like, says who? And then they're like, it's just rude. I'm like, well, there are people participating on the phone. So like, just because I have something, doesn't mean I want to invite you into my house. So not having you on the camera on, and you're just going to have to deal with that. But disability justice spaces, I've just found them so much more comfortable, and so much more inclusive. And I think that's really what I would say is, don't focus on rights, focus on justice.
I like that. I really like that explanation, because I hadn't thought of the differentiation between the two until you just said it. So I really like that. And I think I've had a similar experience where disability is so diverse in how it affects everybody. But I think we all kind of come together in understanding, like, we have, whatever the disability is, someone here has this impairment, someone here has this impairment. And we all, there isn't as much of like you see it in some other activism spaces where like there's hierarchical types of, this is more than this right now. And in the disability community, we just recognize we're in trouble. You have needs, I have needs. We all have places where we're strong and weak, and we need accommodations, we need assistance, and we're all being oppressed in the same way, despite having different causes for it happening. And I think we actually unite more. Like, we don't say like, well, the chronic illness people are over there and the mobility people are over there, because there's so much overlap between everything. I think we just find that we come together because we know we want to live. I think that's first and foremost. We want to survive. We don't want to just survive. We want to thrive. We want to live. And we understand that our lives might not be as, we might not have the same opportunities that an abled person gets in their life due just to circumstance that happened to us. But we want as many opportunities as we can be allowed, and we want to lead full, fulfilling lives to however that speaks and whatever that means to us. And we don't want to feel like we have less rights than other citizens in our own country and in our own community.
And I think what I would say for concluding remarks, I also really like that differentiation between rights and justice, because even if you look back to the civil rights movement for racial justice, when it comes to civil rights, a lot of that stuff isn't enforced. We have these laws, but it doesn't necessarily mean that's what's happening in practice, right? We have these laws that say people of color can vote, right? But do we really have equity if we haven't given reparations, if we haven't dealt with economic justice issues and all of these other issues? So I think that was a really, really good point. And also, I think that to conclude, I really want to hit home the importance of truly listening to people who have disabilities. I think a lot of folks, especially even some well-meaning folks, tend to take this tokenizing approach where they'll select one person and that's their token person, whether it's their token Black person or their token person with disabilities or their token woman person, right? And they put that person in all the pictures and they talk about that person, but then when that person has something to say, all of a sudden it's not important enough. Or stick to your issue, whether that's race or disability or whatever. Stick to your issue. You don't need to do all of this stuff. No, we need to understand that every single thing we do in our work has to be intersectional. It has to include these thoughts. And we can't, like a lot of speakers have said today, silo folks off into one group.
Okay, I'm going to ask folks to give their concluding remarks. It's 5:37, so it's not. I'm not going to be timekeeping. Please feel free to say whatever you feel that you'd still like to communicate to us. And Kathy, how about if we start with you?
Sure. Thanks, Peter. I mean, I just had a little list of things that I may not have mentioned up till now. So, what are the things that disabled people need and that all people need right now? Paid sick leave, income support if they're not able to work, research into all kinds of post-viral conditions, because I think that's one of the things that we recognized in the long COVID community. There have been lots of illnesses that are like this that have been ignored for years, and we all need to move forward together. We need to look at some of the things, getting people out of congregate settings. The state paid millions of dollars for a report from Mathematica, and the one recommendation that they had was use money follows the person to get people out of nursing homes into the community. And it's the one recommendation that all the task forces and advisory councils that have been created so far didn't even bring up. And honestly, I think it's because there wasn't a person who identified as a person with a disability on any of those groups. And we bring something different to the conversation. Obviously accommodations, obviously looking at mental health, and some of the issues that in terms of like when you're thinking about those hierarchies of groups of people, changes that they have made in the legislature for people living in nursing homes, that they have not made similar changes for people in psychiatric facilities. And the biggest thing I can think about that is updating the Patient's Bill of Rights to reflect that we are in the 21st century and that people communicate via devices on social media, and not forcing people to use a communal phone that's in the hallway or write a letter with a stamp on it, because those are the things that are the rights in the Patient's Bill of Rights for psychiatric facilities. And we'd like to see all people in all facilities in Connecticut be able to use their own device, because there is one healthcare system that has changed that on their own. But we know that the state is not likely to change unless they're required to change. And there's another big system that hasn't updated it yet either. So thank you so much.
Alex, how about how do we go to you next?
Well, I just want to again thank you for organizing this and just bringing everyone together, because I feel like even though I've been so entrenched in my own part of the disability community, I still heard perspectives that I had not heard yet, and still heard ideas, and it's really hopeful. It's a hopeful thing for me, because I think just three people sitting and talking about it from very different backgrounds and very different experiences have already generated many ideas just in the 90-minute conversation. And I think that is a starting point, that if we can bring ourselves together this way and then fashion plans of action quickly, I think that's what we have to do right now. And just to put a little emphasis on the current situation with COVID, because some of us still are unfortunately in our houses and haven't left for a long time. We have to really focus, I think, we have a triage moment as grassroots local organizers right now, that we have to focus on protecting the vulnerable populations that still exist, because I think everything has just been abandoned. And I am not certain that this is not going to come back and cycle to hit us in a bad way, or that we are not going to be the vulnerable populations that are sacrificed so that the rest of the country can move on and move forward. And I didn't sign up to be sacrificed for anything, and I'm sure nobody else did either. And so I think that in addition to a lot of the strategies that Kathy mentioned, again, from a detailed legal perspective, for just some ideas that I've come up with that we can even try to start implementing on our own, just on social media, is there's been talk about people trying to come up with a mutual aid homeschooling for vulnerable children and families, finding ways to find medical advocates for those who are falling ill from COVID still, and long hauling. And like I've been long hauling different post-viral syndromes, and I have my own experience about how to handle the hospital and things. And there are going to be people, up to 1 in 4, 1 in 5 people, who are going to be long hauling. And we have to continue to be able to reach out to help guide them through the system that exists, because the system is already broken. And I would never want anybody to go through the 10-year odyssey that I went through. I mean, like, it's like the Odyssey, the book. Like, I don't want anyone to have to go through that. And so if we already know the way to navigate that system, the tests, the doctors, the way to interface with it, we have to make sure that we keep focusing on the long haulers who are joining the ranks of the other disabled people in the country, because I'm afraid that they're going to be left behind along with the people who are already disabled and left behind. And if in terms of mutual aid, people finding a way to create communities that are safe contacts who could provide rides, assistance, shopping, advocacy for medically vulnerable people. Like, if you live a safe lifestyle with less risk, then you might be somebody who can provide that kind of service or resources to somebody who's in need. And again, continue to build media presence online. Try with the local media. I mean, they're not as receptive, but we can still continue to do so. And even coming up with lists of businesses and facilities that we know do practice hygienic COVID practical, COVID safe protocols, and releasing that information to vulnerable people so that vulnerable people can go and start reclaiming bits of their lives, because you can't expect to lock us in the house forever and throw away the key and expect that to happen because of mental health issues, social issues, and just human rights kind of issues. And I think my one plea that I also have we have a strong network of grassroots organizations about many different intersectional issues that exist all through Connecticut. And disability isn't necessarily the focus of all of them, but a lot of disabled people are allies or intersectionally involved in those communities. And I would put out a plea to those communities to please center disabled voices and allow disabled voices into those spaces, make it easier, show up for us, because we show up for you, and show up, just show up because it's a human rights issue, it's a justice issue. And the more we can support each other, that's what we need to do in the local community, and then create momentum to build upwards. But we're not going to get anywhere unless we take care of ourselves at this point. And I think the government structures in place have made that pretty clear on the state and federal level. And it's a matter of survival still at this point for a lot of populations that are vulnerable. And we can't have a 7-second attention span about it. We can't just doom scroll past it. Like, we have to engage it, because like nobody gets left behind. Like, there has to be justice for everybody. If we're justice oriented, there has to be justice for everyone. And so that's my plea to the local organizers in the community, that we keep that in mind.
Alicia, you have the last but certainly not least position of your wrap-up comments for today.
So I really want to underscore really how the role of capitalism colors not only the policies around disabled folks, but also the way that we think about people who have disabilities. And in this society, we think of people as makers and takers. And if you're not contributing to the capitalist machine, you're seen as taking it away. And that helps the society measure your level of deservingness. Do they deserve help? Do they deserve housing? And so I think we really need to reject this line of thinking completely, both in our policy and in our everyday interactions. And we need to come to an agreement that there are fundamental things that everybody deserves and is entitled to, even if they can't contribute or work in the way that the capitalist machine expects, food, housing, quality healthcare, mental health care, freedom from being incarcerated. And I think on that note, also noting that we often use incarceration, whether direct incarceration in prisons, or as was mentioned previously, indirectly locking people up in psychiatric institutions, as a way to throw people away because we don't think they're deserving to live a full life. And so we need to start shifting our practice as a culture, not just in the policy realm, but in the everyday realm, to understand that everybody is deserving of this humanity. And it's a very basic thing, but I think it's an important thing to recognize, not only in the general public, but also in the activist circles who are working on racial justice, economic justice, gender justice, and all of these other really important intersectional issues.
Well, I want to thank the three of you for agreeing to participate in this, and for sharing the things that you have experienced and your insights. I think it's been an incredibly valuable program. It makes me wish we could, schedule another one next week, because I think there's still an awful lot to talk about. And I suspect that all three of you would, gladly share more. But I'm really glad that you made the time to be able to participate in this with us today. I hope that we get to do this again. We all want to hear more of what you have to say. That's going to wrap it up for today. Again, my name is Peter Goslin. I'm with the Connecticut Green Party. We want to thank everyone for Kathy Flaherty, Alex Marie, and Alicia Strong Hernandez for your participation today.